Okay, for this assessment, we're doing the abdomen. So right off the bat, we're just looking at directly at the abdomen, looking for any discoloration, bruising, any masses, or anything that could possibly be tumor-like. Also looking for any maybe edema or striations that could be causing other effects in that area. So then right away we're going to go into auscultation before we are palpating or anything else. I'm going to be going through all 4 quadrants. And I'm just making sure that I can hear bowel sounds and they're not too overactive or hypoactive. So after that, then I'm going to go through and I'm going to listen for friction rubs through the liver and the spleen, as well as going to be listening for bruits. Good. And everything sounds normal going through there, listening through abdominal, aorta, the renal, the iliac, and then also I would be doing femoral as well while I'm doing that. So I'm going to just take this part of my stethoscope and just going to be right underneath your waistline right there, trying to listen to your femoral artery. Good. And everything so far sounds normal. And then as we move through, now we're going to go on to percussion. So I'm going to be going down the axillary lines, the midclavicular and mid-sternal. Good. And everything's pretty good for that, listening for any resonance or dullness going through. And then also doing that, I could find the margins of the liver and also be listening for splenic enlargement. So for splenic enlargement, I'd be coming over the edge and taking tissue slack out. Good. And if there was any sign of any splenic enlargement, I would not do that test as it could cause it to rupture. And then also going through, we can do more palpation for the appendix. So we can be doing a little bit of abdominal pressure throughout the stomach and seeing if it causes pain in between the ASIS and the umbilicus. Any pain with that? Nope, so there's no signs that she's having any trouble with that, and that would be McBurney's sign. And then I could go into more palpation and just doing more of a superficial with one hand in all 4 quadrants. And then I can go in and do a deeper palpation. If it's not too ticklish. Good. So then after that, I can go through and I'm also going to palpate the abdominal pulse. be just slightly to the left of the mid-sternal line. Good. And then gonna go through and palpate the liver and the spleen as well, and the kidneys. So, the inside of the patient. Okay, have you take a breath in and out, and go deeper when she exhales. Take another deep breath in and out, and palpate deeper through that. And then I'd be doing the same thing with the spleen, as long as there isn't any signs of trauma. And then for the kidneys, have one hand underneath and one hand on top. Same thing, take a deep breath in and out. Be pressing deep. And I could do that about 2-3 times to be getting down to the level of the kidney. And then the last couple tests that we would be able to do was a rebound test, which I mentioned earlier for appendicitis. And then we could also do an obturator test and a psoas test. So for an obturator test, I'd have the patient, I'd be passively lifting her leg and bending her knee, and then internally and externally rotating as if there's any pain with that. That could also be a sign of appendicitis. And that would pretty much conclude the abdominal assessment.